Good evening, everybody. Welcome. So as you can see on the screen, my name is Jackie Boychuk, and I am the Marketing and Communications Manager at the Canadian Kennel Club. On behalf of CKC and Purina Pro Plan, I have the pleasure to welcome all of you tonight to our webinar. So as you'll see in a little bit here, we have Dr. Marty Greer with us tonight, and she's going to be speaking on whelping and post-whelping care of mothers. So for those of you who are not familiar with Dr. Greer, she's a renowned veterinarian and lawyer whose life work has been dedicated to improving the health and well-being of pets. Dr. Greer has extensive experience in breeding and raising show dogs. She's been breeding Pembroke Welsh Corgis since 1990 and Danish Swedish farm dogs since 2015. She's also written a few books, including Canine Reproduction and Neonatology, a practical guide for veterinarians, veterinary staff, and breeders, and more recently, a guide for dog owners titled Your Pandemic Puppy. So, as I said, before we get started, a few housekeeping items. Dr. Greer's presentation will be about an hour, followed by a quick message from our sponsor, and then we'll take a 5-minute break. After the break, we'll have about an hour for a question and answer period. As everybody can probably see, we are a big group today. So we're going to keep everybody on mute during the presentation. We can't see your cameras or anything like that. So if you're in your sweatpants, you are in the clear. You will enter questions for Dr. Greer into the Q&A box down at the bottom. So that's not the chat box. I'm pointing at my screen. It's the Q&A box. It looks like two kind of speech bubbles put on top of each other. Please keep your questions general and to the topics that we cover today versus questions that are very specific to one of your specific dogs. Dr. Greer would be happy to take those types of questions after the presentation, and she'll put her email up on the screen near the end for those. We're also recording tonight's webinar, and we'll make it available to everyone afterwards, so don't stress too much about writing down every single detail. You can rewatch the video as much as you want afterwards. So with that note, I will sign off and turn the mic over to Dr. Greer.
Hi, everybody, and thanks for joining. I understand it's cold there. Just so you know, I'm in Wisconsin. I looked up our temperature, and if we converted it into Celsius, it would be 15 below Celsius here tonight with plenty of snow. So I don't want you to feel like I'm in some warm, balmy place, because I wish I were. But, you know, if it was that nice and balmy where you are year-round, if it was perfect weather year-round, it would be very crowded where you live. So it's actually kind of nice to live where you can spread out, have your dogs, not worry so much about everybody being crowded. So we're going to go ahead and start. Tonight we're going to be talking about the postpartum period and weaning. So we've got a pretty ambitious agenda for tonight. We're going to talk about post-whelping care and complications, which will include retained puppies and placentas, maternal skills and aggression, the use of calcium, the use of placental fluid, the Adaptil or Thunder Ease collars, stress for the bitch, not for you, this is for the bitch, and the puppies, pain medication at C-section, eating and drinking during pregnancy, lactation, and weaning, agalactia, which we'll discuss, mastitis, metritis, diarrhea, and eclampsia. And then we're going to talk about weaning, so reducing your bitch's lactation, increasing puppies' food intake, their water, their feeding, and then some kind of fun things about fruits and vegetables and environmental enrichment, because I don't want this to just be kind of a drag. So we're going to start with postpartum care and complications, because heaven knows there are plenty of those. So the first thing I want to talk about is puppy count x-rays. And I've actually been on the phone tonight with a client that just had one of these taken, and she's due to have a litter of 10 puppies. We did the breeding for her, but she lives 7 hours away from us. So I was on the phone with her, and we're going to talk about why should you take an x-ray, what do you do based on how many puppies there are, if they're too few or too many, and reducing the risk of a retained puppy. So the first thing we need to talk about is retained puppies and retained placentas. Retained puppies can be a life-threatening situation if you don't know that there's a puppy left behind. And I've seen bitches go into labor, finish up, look like they're done, settle in, take care of the puppies, nurse, act like everything's great, eat, and 3 days later they come in with a fever, they're sick, They can have a ruptured uterus as a consequence of this. Obviously, you're going to lose the puppy that's retained 3 days because puppies can't survive in the uterus an extra 3 days after labor. And you're also at risk of losing the bitch. Now, the x-ray on this screen was not taken prepartum. This was taken during labor. This was a client that came in that knew that they had one puppy left behind. And on x-ray, you can see that this puppy is in a C-shaped position. So the head is to your left, the shoulder is to your right, and then it swoops around and the back of the puppy is down at the bottom of the screen, again to your left. So no amount of oxytocin, no amount of attempting to retrieve this puppy with your fingers is going to get this puppy out. This is an x-ray of a dog that needs to go to surgery to have a C-section to deliver the last puppy. We've actually had clients have puppies left behind at C-section, which to me is kind of horrifying. One of them did end up with uterine rupture, nearly died, and this was several months after her C-section. This wasn't immediately after. So you've got to be really aware of how many puppies are there and to make sure that all the puppies are born effectively so that you have healthy puppies and a healthy mom. So preventing retained puppies really requires a puppy count x-ray that's accurate, and I'm going to talk about accuracy. And then at C-section, I teach every vet student, I teach every veterinarian that works for me to literally say out loud at C-section, ovary, ovary, cervix. And I make myself do this at every C-section because at the C-section, you're going to see that the uterus tapers down in between puppies, and it can look very much like you're at the end of the uterine horn. And it's not impossible to leave a puppy behind if you see the uterus taper down to a nice narrow spot and you don't follow it all the way to make sure that you've got an ovary on that side and then an ovary on the other side, because of course bitches have two ovaries. They have a uterine horn that's shaped like a Y. They have an ovary at each end, and then it comes down to the cervix. So I literally touch each ovary with my fingers, make sure that I've actually seen the ovary, felt the ovary, and then after I do that, I put my finger down through the cervix. If the cervix is closed, I know there can't be any puppies left behind from the cervix out, but if the cervix is open, I will sometimes, if I can't reach down far enough with my finger, I will have a technician put a gloved finger on and meet my finger in the vagina to make sure that there isn't a puppy left behind. Now, a little tiny bitch is less likely to have a place for a puppy to get left behind, but if you have a good-sized girl, you can certainly have puppies left behind. So it's not only embarrassing to the veterinarian, but it's life-threatening to the puppies and to the dam. So it's super important that we know exactly how many puppies you're having. So I'm going to go through some tips for taking good puppy count x-rays. These are things that you can help your veterinarian do so that they can get good x-rays, but you may also want to share some of this information with them, because if you come out after taking a puppy count x-ray and they say there's 4 to 6 puppies, that really doesn't do you a lot of good. Once you get above 10 puppies, I will cut a little slack to a veterinarian that says, you know, it's kind of hard to see how many there are, because with 10 or more puppies, number one, you have a lot of puppy overlap, and number two, there's a lot of scatter because the abdominal cavity is so wide in a large bitch with a large litter, it can be difficult to see every puppy because the clarity of the x-ray is diminished. The deeper her body gets, the thicker the body is to get the x-ray through, the more scatter there is, the more blurry the x-ray is going to be. But in general, any veterinarian that's taking digital x-rays, and that's going to be most veterinarians at this point, because most veterinarians have moved away from film on x-ray and are now using digital, which is basically computer-based, you should be able to get pretty clear x-rays. So the other thing to know is back in the 1960s and the 1970s, x-rays weren't as safe as they are now. It's very, very safe to the bitch and to the puppies to take an x-ray. So for the people who are pushing back saying, I think it's going to cause a problem with my female, I think I'm going to have puppies with cancer, that's really not going to be the case. It's very safe. The amount of radiation that we use now to take digital x-rays is infinitesimally small compared to when the x-ray reports initially were published about the dangers of x-raying during pregnancy. So number one, you want to take your bitch to the veterinary clinic fasting, so no breakfast the day that she has the x-ray for a puppy count. Number two, we will stimulate the bitch to have a stool either by matching her or using a suppository. Now matching is exactly what it sounds like. We take a match, please use paper matches, not wood matches, because wood matches are a little hard on the hiney. So we literally take a match. I usually use 2 matches and a suppository and put those in the female's rectum. I don't know who ever decided that matching a dog was a good idea, but it works beautifully for getting a dog to have a stool. People use it in obedience competitions so their bitch or their dog doesn't go out into the ring, or if they're doing field trial work or any other kind of competition work, nobody wants their dog to have a stool in the competition. So if you match them before you run them, they're going to empty their colon. You're going to have a nice empty colon for a TCI. You're going to have a nice empty colon for a puppy count x-ray. You'll have a nice empty colon if you're running a competition. So we put matches or suppositories in the bitch's rectum, send them back outside, and literally within 2 minutes, you're going to have probably 95% of those girls having a stool very, very quickly. So on days when it's 15 below zero, you're not standing outside for 20 minutes trying to get her to have a stool. It works really well. It's very effective. It keeps the staff on time so that they're not taking a bunch of time out of their schedule waiting for your dog to have a stool. So we can't control, if you feed your bitch before her puppy count x-ray, we can't control it. I'm not going to make her vomit to take an x-ray, but I can make her have a stool. So be very, very attentive to the fact that she should go in fasting, and if you haven't adequately aired her, that my staff is empowered to say they take the first x-ray, and if they take the x-ray and they see that there's a lot of stool in the colon, they don't even take the second x-ray. They send the dog right outside. The third thing we do is take a right and left lateral. A lateral means that the dog is laying on their side for the x-ray. So we'll put them on one side down. We'll roll them under. We don't want to roll them over because we worry about bloat. If we roll them with their feet over the top of them, we roll them with their feet underneath them. Take an x-ray of each side down. So a right lateral and a left lateral, boom, boom, back to back as long as the colon is empty. And then we want to make sure we're taking this after day 55 of pregnancy. Between day 45 and day 55, the skeletons are just starting to calcify, so you're not going to get good quality, clear x-rays of well-developed puppies if you do it too early. So those are my 5 little tips. Now, digital x-ray, you can't control what your veterinarian uses for equipment, but the other things you can. So air the dog, fast the dog, make sure that they take 2 x-rays, and I never take one with the dog on their back because the puppies will lay over the backbone and you can't effectively count the number of puppies. So I'm going to show you some examples. This is just a reminder to walk her before you go in, and if you don't have a stool, match her. I love this picture. It's pretty funny. So make sure that she has a chance to have a stool. I see Jackie's over there giggling. So why do we want to do this? Well, this is a nice demonstration of an x-ray, and hopefully you can see it pretty clearly on your monitor. It looks like there are 2 puppies when you look at this x-ray, but she had a lot of stool in her large intestine. That real granular material under her backbone is fecal material. So this is a dog we matched, sent back outside, and when she came back in, we could see the same dog. 2 minutes later, there were 3 puppies, and that's very important to know at 2 o'clock in the morning. Can I go to bed? Do I need to go in for a C-section? Am I in trouble? Is everything okay? And even my own bitch, I knew she had 5 puppies when she had her first litter. She delivered 4. She was merrily on her way. She's looking at me like, okay, I'm good. And I said, no, really, there are 5 puppies. And she said, no, I'm good. And I said, no, really, there are 5 puppies. And I gave her this waft of oxytocin, the teensiest bit of oxytocin. And she looked at me and she said, yes, I think you're right. I think I'll have the 5th puppy. So even at my house, I do this because it's very important that we know how many puppies there are. Here's another demonstration of taking 2 views. This is with the dog with her first side down. And then when we flipped her over, we could see there were 3 puppies. So instead of 2 of the puppies having their skulls and their backbones almost perfectly superimposed over each other, as you can see in this view, you can see in this view that there were clearly 3 skulls and 3 backbones. So I count skulls, then I count backbones, and then I make sure there's a head for every skull, or a skull for every backbone and a backbone for every skull, so that I have followed those puppies. So I'm pretty careful how I count. I want to make sure I send my clients home with accurate information. Here's another example of an x-ray we took with one side down. It's very clear that there are 7 puppies. Flipped her under, and the 8th puppy made its appearance. So that's very important to know. So what else can you do if you didn't get an x-ray taken or you didn't have good timing, so you didn't know when to take the x-ray? Well, ultrasound can look for other puppies, which is useful if you're at the vet, but most people aren't going to have their own ultrasound machine. And then a lot of people do use the fetal Doppler, which is something that people sometimes use on themselves to monitor their pregnancies. But if you have a puppy that doesn't have a heartbeat, you are not aware that you have a deceased puppy left in the uterus. So a dead puppy in the uterus is just as bad as a live puppy in the uterus. So you absolutely need to know how many puppies you have, and a fetal Doppler only works if all the puppies are alive. And then Whelpwise is a uterine contraction monitoring service we have in the US. It's based out of Colorado. And I'm quite certain that Karen probably also works with Canadian breeders. So again, Whelpwise is a great service to monitor uterine contractions. It doesn't tell you how many puppies you have, but it does help you with uterine contractions and the patterns that you should be seeing, and intervention if necessary. So Karen at Whelpwise and her team will help with intervention with calcium, with oxytocin, and with letting you know if you're in trouble and need to go in for a C-section. Number 2, I want to talk about maternal skills and maternal aggression. Most bitches that are going to have maternal aggression issues are going to be inexperienced bitches or bitches that wake up from a C-section with little aliens crawling around on the outside of their abdomen, and they don't really know how they got there. Now, that being said, my own personal bitch had her first litter a year ago, and she had the first puppy fine, she had the second puppy fine. The third puppy came out and it flipped around and it started to try to nurse while the placenta was still inside vaginally, and she decided at that moment that that puppy was not okay. And she literally tried to grab that puppy, and if I hadn't been right there on top of it, she would have grabbed and probably killed that puppy. So even bitches that have vaginal birth will sometimes have issues with aggression. So it took her 3 days, because of course I wasn't expecting that kind of a response. Her mother had been a great mother. I wasn't expecting that response. It took her 3 days to figure out that those were her puppies and she should take care of them. It's a little more understandable at C-section. If she wakes up and doesn't know where these aliens came from, you can kind of understand. But there are most bitches, when they wake up from C-section, they turn around, they look down, and they go, oh, puppies. Okay, I'm good with that. But not all. So I want to give you some tools to help you in case you do have a bitch that ends up with some aggression. Low calcium can certainly cause aggression, so supplementing calcium can help. Saving placental fluid does help. I save placental fluid at C-section, so I have a sterile bowl I keep in my surgery pack, and I will take some of the amniotic fluid and deposit that into the bowl. If you can't have your veterinarian do that, ask their technicians to do it, or maybe even have them save a placenta or two for you to take home, not necessarily for the bitch to eat, but for you to kind of rub on the puppies, because by the time we get done resuscitating puppies in the towels that we use, they smell like laundry soap and they don't smell like puppies or the bitch. So the placenta or the placental fluid can be really helpful. The other things are Medicam, Rimadyl. Medicam is meloxicam, Rimadyl is carprofen. Some of those prescription medications are very, very important for the females to have post C-section. C-sections are painful. You make an incision, and after the anesthesia wears off, there's incisional pain. And I can assure you that the bitches are better mothers if they have post-op pain medication. I personally don't like tramadol. I don't like opioids. Those make the bitches groggy. I'm always concerned that they're going to lay on a puppy and cause some damage to him unintentionally. So I like to use meloxicam, carprofen, one of those post-op pain meds, and I've been using those drugs for over 20 years and not having problems with the puppies getting enough of that drug through the milk to cause them any liver or kidney problems. So if you have a veterinarian that's reluctant to try it, please convince them that they need to get the dogs on some pain medications. The other things that help are the Adaptil or the Thunderease collar, the pheromone collars. Those are different than the herbal collars with some of the more fragranced kind of things like people use as an alternative to a pheromone. So pheromones are the hormone that a bitch produces in her mammary fluid, in her mammary glands and in her placenta fluids. So if you use the Thunderease or the Adaptil collar, we put those on the bitches that are scheduled to have C-sections 3 days before the C-section. If we don't have a C-section planned, we put them on when she walks in, and we plan the C-section that day. So those are very helpful in producing the kind of pheromones that calm the bitch and do a better job. Physical separation and muzzles sometimes have to happen if you have a bitch that's going to be aggressive and you just can't do anything about it. Is she may have to sleep in a crate and leave the puppies in the whelping box or vice versa, and then put them together only to be nursing when you're physically present and physically can keep a muzzle on her. And then I think gabapentin can also be helpful in calming the bitches if they're a little bit agitated or a little bit nervous. I don't mind using gabapentin on the post C-section bitches. So we see all kinds of aggression. The puppy on the left-hand slide is a Belgian sheepdog puppy that lost his right ear from his mother. The puppy on the other side is a little bit older puppy, but still maternal aggression can be pretty dramatic. So they can cause some serious harm. So calcium, we know in the mini bull terrier has been documented to reduce aggression, and we probably think it happens in other breeds as well. So we'll see less aggression toward puppies and less aggression toward people if they're on an adequate amount of calcium. If you take your dog to the vet and ask for a calcium level, the problem is that most veterinary clinics can only measure total calcium and not ionized calcium. Ionized calcium is the active form, so many times just a total calcium level doesn't tell us what we need to know about the bitch's calcium level. So oral calcium can be very effective. The gel works faster than the tablets, and the tablets are pretty effective as well, but they're not going to give you the speed of onset that you need to have better labor patterns, and they're not going to help you with reducing the risk of aggression. So this is the Oral Cal Plus. My bitch found this empty tube in the garbage. This was after her litter of puppies. She decided that it tasted so good that she would carry it around with her. I did take it away before she ate the plastic, and you certainly don't want your dog dosing their own medications. So don't interpret this slide incorrectly. But I do want to share with you the palatability of this is such that she was willing to take the calcium gel. CalSorb does not taste as good as the Oral Cal Plus. So placental fluid, like I said, we don't want puppies smelling like Tide. I send it home in a little bottle. Please refrigerate it. It does not have preservatives in it. It doesn't come that way. So refrigerate it and then just dab it on the puppies' heads and on the puppies' rumps at the time that you need the bitch to start licking them. And you can reapply that several times until she gets the hang of motherhood. The Adaptil and Thunderease colors look like this. They're not the essential oils. They are the pheromone colors. So make sure you get the right ones. Amazon sells these. And then remember, stress and overcrowding, too many other dogs, especially in certain breeds, don't get along well. So don't invite the neighbor kids over. Don't invite their neighbor dogs over. If you have Shiba Inus, keep the other dogs out. If you have golden retrievers, they're probably okay with another dog hanging around them. But there are some breeds that are pretty aggressive toward other dogs. So don't even set her up for that kind of failure. If she's stressed, she's going to be barking at the other dogs, and she's not going to be laying down and being a good mother. She's going to be worried about those other dogs and protecting her babies, and she won't be laying down, relaxing, and lactating well. And then, like I said, post-op pain medications, they are not labeled, but I use a lot of these, and I do try to avoid the narcotics simply because I don't want the bitches drowsy and laying on their puppies. Eating and drinking, they are also going to eat and drink better after a C-section. They're going to be feeling better if they're on pain medication. But remember that these bitches end labor, whether they had a C-section or whether they had vaginal birth, they come out of this tired. They may not feel great. They are exhausted. They didn't get enough to eat and drink during maybe a 12 to 24-hour period. So very important that we give them adequate support. Fluid intake, if you have a bitch that's not adequately drinking, either she's so devoted to her puppy she won't leave to go to the water bowl, or she's just not feeling well, make sure you keep her hydrated. You can give sub-Q fluids. Yes, this is a cat, but it's the only sub-Q fluid picture I had that I could show you that wasn't on somebody else's website. So giving sub-Q fluids to your bitches can be helpful. If you can get her to drink, great. If she'll drink water, that's great. If she won't drink water, you can give her beef broth, chicken broth, ice cream. You can certainly buy electrolyte-containing solutions that can improve their interest in eating and drinking. Salty foods like pretzels and potato chips do a great job in getting the females to eat and drink better. You can use other flavors, whatever she might happen to like. If she likes scrambled eggs, great. You can take a can of dog food and mix it in with her water with a wire whisk and get her to drink the water more effectively. But if nothing else is working, don't hesitate to talk to your veterinarian or be prepared to give sub-Q fluids. And then eating, she should be eating 2 to 4 times her normal intake after she has the puppies to adequately
It's 7 o'clock.
produce the milk and food fluid that she needs. So if you have to top dress the food with some canned food, that's fine. You may need to see your veterinarian if she's not feeling well enough to eat. So don't hesitate to contact your veterinarian, but a top dressing of some yummy canned food can really make a difference in getting her to eat. 4 times the amount of food is what she may need if she has a large litter. So if she's got, 12 Labrador puppies, she's going to need to eat, instead of her usual 4 cups a day, she may need to eat 16 cups a day, so be prepared. Agalactia is the lack of milk production. That is the inability to adequately lactate. So it is not the lack of galactic creatures, which is what this slide is trying to make you laugh a little bit about, but it is the lack of milk production. So there are some nice drugs on the market. We can use metoclopramide. We call it Reglan in the US. You can use domperidone, which may need to be compounded, but those are both drugs that can be used to improve lactation. They're really not meant for that purpose, but those are the side effects for the drugs. So if your veterinarian looks at you a little crazy, like you said, I want metoclopramide because it's going to make her make better milk, they may look at you like, I've never heard of that before. Most veterinarians use that for vomiting and diarrhea, but it does a nice job of improving lactation. As herbal products, fenugreek can be very helpful, but watch out for the fenugreek products that may have combinations of other things in them made for humans, because just because it's safe for a human doesn't necessarily mean it's safe for a dog, so stick to just straight fenugreek. Oxymama is a veterinary product that we have in the US that can improve lactation. It does contain fenugreek. And then on the side of just getting her to take some foods that might help her to lactate better, bratwurst, I have no idea why bratwurst works, but we have very good success in feeding bratwurst, the sausages. Cooked, please. I fry them. I don't boil them in beer. I fry them and give the drippings and the bratwurst to the females. Small dogs may get a portion of a bratwurst. Large dogs may get 2 or 3 bratwurst a day, depending on how much they can tolerate. Certainly don't want to cause diarrhea, but brats can really improve lactation. The bratwurst herb mix does not contain fenugreek. I don't know what's in bratwurst that works, but it works. I learned that from a Newfoundland breeder of ours. But also oatmeal and sweet potatoes can work. So those are products that the lactation nurses on the human side use. So root vegetables and oatmeal, for some reason, also help to bring in the milk. And of course, oxytocin. So metoclopramide and domperidone make the dog make milk, and oxytocin lets milk down. So those 2 drugs can be used in combination because they don't do the same thing. They overlap their use. And then warm compresses on the mammary glands can also be very helpful in getting the bitch to lactate. That improves the blood flow to the mammary glands, and it will improve the lactation. So put on some warm compresses, and as soon as you pull those off, while the breasts are still warm, put the puppies on. So the dose for Agalactia for metoclopramide is 0.2 to 0.4 milligrams per kilogram 3 times a day. That is a dose that you can share with your veterinarians, and I'm certainly happy to share that information if your veterinarian wants to contact us. Like I said, oatmeal, root vegetables, and bratwurst, good old brats. These are the drugs that we use. Like I said, Oxymama is an herbal preparation, metoclopramide is Reglan, and oxytocin let down milk. And we're going to try this video, see if we can get this to work. Is it working? Can you hear it?
When you looked in my direction, I thought my heart might explode. My heart was racing and I thought it might explode, because my sympathetic nervous system caused norepinephrine to stimulate my sinoatrial node. When you looked in my direction, when you first looked into my eyes, when you looked into my eyes, my stress response diverted blood flow from my stomach and intestines, and it felt like butterflies. I knew that I wanted to marry ya, as my ventral tegmental area sent signals to my nucleus accumbens. And oh, oh, oh my lord, the anticipation of reward, that dopamine starts pumping. I know oxytocin is the potion of devotion. Give me that dose of dopamine. Hold the serotonin is still going, growing stronger all the time. I love you, and I'm never gonna change my mind. When you first smiled at me, I did foolish things. Really stupid things. Because my judgment was impaired by a reduction in activity in my amygdala and the frontal cortex of my brain. When you first smiled at me, I began to fall. One smile and I began to fall. And so did my serotonin levels, producing anxiety. I couldn't eat or sleep at all. Then a year or two went by with serotonin on the rise, till I was feeling comfortable and calm. Now every single time we touch, I get that oxytocin rush. Our bond has never been so strong. I know oxytocin is the potion of devotion. Dial back that dopamine. Here comes serotonin, still going, growing, stronger all the time. I love you, and I'm never gonna change my mind.
Okay, so that's a much better way to explain oxytocin, serotonin, and norepinephrine than I could ever do. So I thank to the people who made the video because I think that's kind of fun. All right, mastitis in the postpartum bitch usually affects only one gland, but it can affect several in a row. Typically, the symptoms you're going to see will be a hot, swollen, painful gland. Many of the bitches will run a fever. They'll have a change in the milk character. It might abscess open. I'll show you pictures of that. Usually it is not a surgical disease. Most of the time it'll open, drain, and then it'll heal on its own. And I do leave puppies on a nurse. As long as the bitch isn't too sick, I'll let the puppies nurse. Treatment consists of a course of antibiotics, fluids for supportive care, anti-inflammatories if she's running a fever, and if the puppies are old enough to start weaning, we can use cabergoline to help drop the amount of lactation that she's doing. So it's pretty effective in managing that. Now, there's two significant reasons that bitches run a fever after they have puppies. One is mastitis, the other is metritis. If it's not one of those two things, metritis can either be a retained puppy or a retained placenta. If it's not one of those two things, then we need to consider her a postpartum bitch that accidentally or in addition to that has something else wrong with her. But the first two places to look, if you have a female running a fever and it's not because the room is too hot taking care of the puppies, is mastitis and metritis. Mastitis you can usually diagnose yourself because it looks pretty clear. This is a picture of a dog with mastitis in 2 glands. This is how it starts looking on day 1. Now this is a series of pictures that were sent to me by a client, but this picture is not one of them because she did not go from being a beagle into a golden retriever. So on day 2, the mammary gland starts to look like this. So you can see that redness is there, but you can see that shiny section that's real white colored and shiny. That's going to open up and slough and turn into this kind of a lesion. So this client was very kind and sent me a progression of photos so you can see each day how this progressed. And then you see as this tissue sloughed off, it starts to heal in, and then eventually it'll heal on its own. Usually we don't close these surgically, usually we don't need to, but if it's a really large gap, sometimes we do need to. I still let puppies go ahead and nurse on these bitches. I don't usually take them away as long as I don't have some other reason to, but you do sometimes need to cover the gland so that the puppies don't get caught up in the wound itself. This is what gangrenous mastitis looks like. This dog does need surgery. Fortunately, this is pretty rare. That's when the skin just turns black. I've only seen 2 cases of this, and it is a lot more serious. You definitely need veterinary intervention if you're seeing gangrenous mastitis. Metritis, like I said, is the other common reason that we see females postpartum in the first few days run a fever. It can be a retained puppy or a retained placenta. So ultrasound will help us look for retained placentas. X-ray and ultrasound will help us to look for a puppy that might be retained. So if you didn't have an accurate puppy count, you might have to check this out with going to the veterinarian and having ultrasound, X-rays, or both. Again, treatment consists of an antibiotic for the fever. I use prostaglandins to help the uterus contract enough to expel the placenta because by this point oxytocin is usually not highly effective. The uterus tends to become refractory to oxytocin at this point, so you may need to have a veterinarian prescribe prostaglandin injections for this. I'll give IV fluids to help bring down the fever, and I try not to spay them, but if that's your only choice, if she's going to get sicker and sicker and have to go to surgery, then you might have to spay her. I try to avoid it. I don't think I've ever spayed a dog for a retained placenta. I certainly have taken dogs to surgery for 3-day or 4-day or 5-day postpartum retained puppies. So that tends to be a surgical thing because most of the time the puppies at that point have lost all the fluid around them and they've basically velcroed to the lining of the uterus. So most of those dogs do end up going to surgery. You may not need to spay them, but you probably will have to go to surgery to get rid of the puppy that's retained. This is what on ultrasound a retained placenta is going to look like. So your veterinarian can ultrasound and see that. And then diarrhea postpartum, another very, very common kind of postpartum complication. I tend to treat these pretty conservatively. I use kaolin and pectin, not the human kaopectate. I'll use a bland diet and yogurt. I'll use probiotics. I'll monitor hydration and give fluids if necessary. And we want to avoid metronidazole on our lactating bitches. So we want to try to find other drugs that are more appropriate for dogs with diarrhea. Human kaopectate is no longer kaolin and pectin, at least in the United States. They changed it a few years ago, so it's basically Pepto-Bismol, which metabolizes into aspirin. So I use the veterinary kaolin and pectin, which is basically from clay. Kaopectate on the human side is the same thing as Pepto-Bismol, which metabolizes into aspirin. Not good for newborn puppies, not good for moms. I use kaolin and pectin even on newborns if they have diarrhea. So managing the postpartum bitch, I also use probiotics. It is not a labeled use, but many presentations in the United States 2 and 3 years ago, just before COVID, when we could still actually go to lectures, there was a lot of discussion about probiotics in our postpartum bitches, starting them even before they had their puppies to reduce diarrhea, reduce the risk of mastitis, and reduce the risk of metritis. But I am not allowed to say that that's a labeled use. We don't have label claims for that product on probiotics, but it has been discussed widely in the veterinary community. Eclampsia is a condition in bitches where they will drop their blood calcium. It's primarily a problem in small breed dogs with large litters. Now, this is a cow, I get that, but cows that have low calcium become weak. They develop muscle weakness and they become flaccid and they go down. So that's your down cow. Dogs become tetanic and they have seizure type of activity. So it's a completely different, even though the calcium is low in both of those, it's a completely different circumstance of what you see clinically. This is what we see clinically in a small breed dog with a large litter. She's going to have way too little calcium in her system, and she's going to end up really quite sick. And having these kind of seizure activities, they'll come in with an elevated temperature. It'll look like a seizure, but again, as soon as you realize that this is a postpartum bitch and that calcium is what she needs, she probably will be able to be pretty well managed by the veterinarian. She may not be eating enough and taking in enough calcium, but you don't want to start calcium supplementation until she goes into labor. If you give calcium too early during the pregnancy, what effectively you do is you tell her body that she doesn't need to mobilize calcium from her bones, and then when she actually does need to do it to feed the puppies, her calcium levels drop and you get into trouble. So if you have a small breed dog with a large litter, it is absolutely essential that you're giving her calcium. I start with calcium gel during labor and then I switch to calcium tablets or calcium powder. There's not enough calcium in cottage cheese or ice cream. You really have to have a calcium supplement. During treatment, it's very important that this is only done by a veterinarian. They have to get intravenous calcium, and if it's given too rapidly, it can cause cardiac problems, including sudden death. So very important that you get the dog in for medical care. So it's better to prevent it than it is to try and treat it. It is a medical emergency. It does require veterinary intervention. The only way to test for sure, like I said, is an ionized calcium test, and most veterinarians don't have the capacity to do that in their clinics. So it does require some finesse in managing these guys and monitoring their EKG. So weaning is our next important topic. So I want to go ahead and talk about this. The first thing we want to do when we start weaning the puppies is start getting the puppies on food, but starting to have the bitch reduce her lactation. So by reducing her food intake by about 50% and reducing her water intake, you can start getting her to taper off on her lactation. I only use cabergoline if I need to, if it's a bitch that I really, really, really have to get her to stop lactating because of mastitis or because she has some other really significant complication. I do like to put some of these girls in a bathing suit, and this is not the kind of bathing suit I would use because it's very hard to get her to wear 4 bathing suits. But it works really well to get these kind of bodysuit bathing suits, or even the medical appropriate. They make these now for dogs. They also make lamb sleeves. A lamb sleeve is meant for a show lamb. Again, you can buy those on Amazon. But this way you can start weaning the puppies. If you have puppies that are really insistent on nursing, or the bitch needs to have them weaning and you're just not making progress, if you cover her with this kind of a bodysuit, she can still be with her puppies. She can still hang out with them. She can teach them the things that mother dogs need to teach them. But it's safe for her to be around the puppies without them continuing to bite at her. I mean, some of those lab puppies, they're like piranhas, man. They're pretty evil. I actually had a client that called me one day several years ago, and she said, my sister's dog has mastitis. And I said, well, what makes you think that? And she said, well, she won't lay down and let the puppies nurse. And I said, okay, well, what kind of dog is she? They said, she's a lab. I said, how many puppies does she have? She said 12. I said, well, how old are they? And she said 6 weeks. And I said, well, what are you feeding the puppies? And she said, feeding them? And I said, what? They're 6 weeks old. She's not giving them food yet? And she said, no. I said, how about water? How are they drinking? And she said, water? And I went, oh no. This poor girl had done the entire nutrition and water intake for 12 6-week-old Labrador puppies with no water bowl and no food. I said, okay, this is what she needs to do. Number 1, take the dog out. Number 2, put a bowl of water down. Number 3, go to the store and buy a bag of puppy food now. So, I mean, it's hard to imagine that people didn't understand that, but she really didn't know that that was what she had to do. So as we decrease the lactation, we want to increase the puppy's intake. I usually start with dry kibble softened with water. I am very careful when I feed dry kibble. I've seen a couple of puppies, usually the biggest puppy in the litter that runs in, grabs a mouthful of food, is the first puppy at the dish because it's the biggest, hungriest puppy. Aspirate and choke on a piece of dry kibble. So I'm pretty careful in softening my food with water until I'm really certain that the puppies are able to chew the dry kibble. Water, don't forget to start water. I start water at 2.5 to 3.5 weeks of age, depending on the kind of the breed of puppy and the kind of puppy that they are and how aggressive they are in eating and drinking. Water is the most important nutrient we give to our dogs, so make sure that you're giving them water. I start with a heavy, shallow dish. This nice clear pie plate works really well. You can throw that in the dishwasher. For outside use, I use that chicken waterer because it's a little bit easier to keep the water clean. I don't have leaves and grass and other things in it. So I buy a chicken waterer for my puppies. I just go to the farm store and purchase that. So these are really nice tools to get the puppies started on eating and drinking. I also like the water bottles. Lixit makes a really nice bottle with a tip on it, and you can teach puppies, even 3 and 4-week-old puppies, to lick out of a Lixit bottle. They're like the giant gerbil bottle with the metal tip and the little ball on the end. I'll put chicken baby food or peanut butter or something on the tip of the water bottle, and very quickly I've got puppies that are taking water from a bottle. Works really well. They don't spill it, they don't lay in it, they don't walk through it, they don't make a mess of it, they don't turn it into a swimming pool. It's a really nice way to get water into puppies, but you want to make sure that all the puppies are using it, that it's not just a couple of them. But it's surprising to me how quickly puppies figure this out. It's pretty cool. Again, like I said, feeding and watering and weaning, we want to put it in a shallow, heavy dish so that the puppies can get started, and we start them on our puppy foods. There are occasionally bitches that will vomit for their puppies. This is my own personal farm dog. Her second litter, I was outside with her in the dark with the puppies, and I could hear this funny noise, and I suddenly realized that she was vomiting for the puppies when they were trying to nurse. So again, if you're seeing a bitch vomit and she's not sick and the puppies are at weaning age, it may be that she's trying to feed the puppies, so that probably means you need to increase the amount of food you're putting in a bowl. So feeding and weaning, important that we get these puppies started on an appropriate kind of puppy food. Feeding techniques, I use things like, this is a chip and dip tray. You can buy them for $1 at the dollar store. Nice way to separate the food and keep the puppies from fighting over the same part of the bowl. I had a client build one of these for me so I could again separate the puppies and they had their own source. And then important that as we're transitioning puppies to their new home, that we send along some of the food or ask them to purchase the same food you're feeding, so that as they transition to a new home, they don't have a food change at the same time that they're moving out of your home and into a new home. So send some food, Send some water. Have the people bring an empty water bottle and fill it with your water so you can transition them. Make sure you're using a probiotic to reduce the risk of those puppies having diarrhea. And then one of the things I most recently learned is the use of Albon, or one of the trimethoprim sulfate products that we use for coccidia. It can be used for the last 3 days the puppy's at your house and the first 3 days that they're at their new home to stabilize bacteria in the gut along with the probiotics so that they are less likely to end up getting parvo. Now, I don't know how much parvo you see in Canada. We see less of it in the northern states than we see in the southern states. If we get down to Texas and Arizona, we see a lot of parvo. So if you don't have a problem with parvo, you may not need to do this. But if you do have parvo outbreaks, Albon is a really nice way to stabilize bacteria and get things going okay. Fun with food. I think there's some really cool things we can do with food that make it fun for our puppies. I've had a lot of fun doing this. This is a little French bulldog puppy that came into the office, and he was kind of a naughty little kid. He was a singleton. You know how singletons are. And I was trying to keep him busy during the office visit, but this works really well. This is peanut butter and a ginger snap in a muffin tin. So you can buy a muffin tin at your dollar store. I just stuck the ginger snap to the bottom of the muffin tin with some peanut butter, and this kid was busy for about 20 minutes messing around with this. So if you have puppies that you're trying to keep occupied, or you're selling puppies to people and they need to keep them busy, this is a nice tool to use. Yes, you can use puzzles, you can buy dog feeding puzzles and all kinds of stuff, but frankly, I'm kind of too cheap to go buy some of those things and not know if the dog's going to use them. So I'll use something as simple as, yes, a muffin tin. The other thing you can do is you can freeze their food. You can take dry kibble and put water or yogurt and put it in the freezer. You can have 2 muffin tins, one in the freezer, one in front of the puppy, and then throw the next one in the dishwasher. And you can have a lot of fun with having these puppies have something to do, because it takes them a lot longer to eat their food if it's been stuck in the freezer and they have to wait for it to thaw out. So there's some fun things you can do. I also have a lot of fun with fruits and vegetables with my dogs. I like to experience 100 experiences with my puppies in 100 days. And during COVID in particular, that's been difficult. In the Canadian winters, that can be difficult. So doing something really simple with fruits and vegetables can be a lot of fun. This week, my puppies had watermelon, cantaloupe, this is honeydew melon, Brussels sprouts, and apples. So remember, grapes and raisins are not okay, but most other fruits and vegetables are fine. I cut this honeydew melon in half, scooped out the seeds, and then I split it into sections, sort of like you would a grapefruit segment. Put it down. Yes, this is a litter of corgi puppies, and they were having a blast, to the point that I had somebody that bought a puppy from me 2 summers ago, and she called me during the second summer she had the puppy, and she said, "Did you feed the puppies cantaloupe?" And I said, "No, actually I fed them honeydew melon." And she said, "Oh my gosh," she said, "I cut a melon the other day and the puppy went nuts. He smelled it, he knew what it was, and he wanted some of it." So you can have fun. You can do 100 things in 100 days without having to work that hard at it, because you're eating fruits and vegetables anyway. So make sure you're sharing them with the dogs. You can really have a lot of fun with some very simple things that you have around the house, and you don't have to work very hard at. There's a farm dog throwing himself into the mix. So there's farm dogs and corgis in the same pen. Don't get confused. I have 2 breeds, and I don't breed them together, just to be clear. I have farm dogs, I have corgis. The two are separate breeds. So no grapes and raisins, no onions, potatoes, or corn. Avoid the corn and the potatoes because they're starchy. Avoid the corn because of the corn cob. Be careful with rinds, too much skin on the product. And you don't want to exceed 10% of their daily intake. So keep it 90% or more dog food, but a little thrown in here and there can be a lot of fun and give you some variety, give the puppies some variety. Now this video is a little hard to see exactly what's going on, but this is a farm dog puppy that is racing through my house, chasing a grape cherry tomato. So not a real grape, a grape cherry tomato. So this puppy, she had a blast chasing this thing around the kitchen. So you can do some really fun, simple things that don't require a lot of work. So you can't see it because it's rolling around on the red carpet, but there it is. So environmental enrichment, very important in this era of COVID and confinement and all the other things. So some of the things that I've also done is I went to Walmart one day, and it turns out at my Walmart store, and I'm probably not much different than most of you, there were 11 styles of bath mats at the Walmart store on one day. Now for $10 a bath mat, I bought 2 of every style because I wanted to have one I could keep clean and one that I could put in with the puppies. So I put these underneath the puppies at the very beginning to give them good footing so that they don't end up with hip dysplasia and splayed out. So if they have better footing under them, you can use these mesh mats that are really nice and effective to let the urine drain through, but it keeps the puppies on good footing so the surface that they're on is not too slippery. But you can buy all these different kinds of mats. I bought bristly ones and woven ones. There were round holes and square holes. There were shiny ones and not shiny ones. There were dark colored ones and light colored ones. There were some with slats and some that were holes. So I got 11 different experiences in one trip to Walmart for $100. Now I'm pretty sure the lady at the checkout thought I was a little crazy buying 22 bath mats, but um, it was fun. It was good experience for the puppies. You can see these mesh ones allow the urine to drain through, but it gives them good footing underneath their little toes so that they can grip and crawl over to mom and get a good nursing and still get heat through it, heat coming up, urine going down, and good footing underneath them. So there's lots of cool things that you can find it with a little creativity. So this just shows different pictures of the bath mats. This slatted one is kind of cool. The shiny one's kind of cool because you've all had puppies that have left your house and then they say, gosh, he won't walk on a slippery floor, or he only walks on carpet, or he only walks on certain surfaces. So you want to make sure that you're giving these puppies some experiences beyond the time that they leave. This is a $6 mirror from Walmart. You can buy a mirror, set it up in front of the puppies, give them the chance to experience something new. You can buy wobble boards. You can make wobble boards. People that do agility like these are exercise boards for people and for dogs. So again, an inexpensive way that you can give the puppy some new experiences. I've seen people, and I've actually got a set of my own of these little tiny baby agility equipments, little tiny dog walks and little tiny A-frames, so that the puppies get used to that feeling underneath them. So if you have puppies that are of a breed that might be going into agility homes, they can start off with this. We called one Magellan because he was out there all the time wandering around on things. So you can have some really fun experiences. This is my sun porch. I set up one of those dog things that I had a student build for me. So I have silverware and pie things and noisemakers and balls and empty bottles and all kinds of stuff hanging from it. So the puppies have all kinds of experiences. And then this other thing right in the center is a rabbit hutch. So I purchased it online and had it shipped to me, and I built it so that the puppies could go up and down and off of things and go in and out and see what doors are and just learn different experiences. They do a little chewing on it, but it's not anything that's going to cause them any harm. And then that large Y-shaped piece is just a piece of plumbing that puppies go in and lay down. And I'll see like a really long puppy because one puppy's tail is sticking out one end and one puppy's head is sticking out the other. So there's actually 2 puppies in the same thing, but they look like they're really, really long puppies. So you can do some fun stuff. And then that tray next to my puppy jungle gym is a litter box tray. So I litter box train my puppies when they're very, very young. At 3 weeks, I start them on wood pellets. I've never had a puppy eat it, but I can litter box train my puppies so that by the time they leave my house, they're litter trained so that they can get through the night clean and dry. When they're 3 and 4 weeks old, I don't even have to worry about it. And I also have had great success with sending that home with people in a Ziploc bag, and then if they put it in the yard, in the part of the yard that they want the puppy to go potty in, that they now have a tool to start housebreaking those puppies because they know what they're supposed to do when they get outside. They recognize the wood pellets as a surface, a substrate that they're familiar with. I've also had bitches come back to my house that have had their own litters of puppies, and when the puppies are 2 weeks old, the bitches are eating and drinking so much they can't get through the night, and they will get up out of the whelping box and go into that tray and go potty and come back into the whelping box and keep the area clean for their puppies. So it's actually pretty cool. The puppies I purchased as young dogs, I did not litter train. They don't know how to use it. The puppies I raised as litter puppies, when they've been raised at my house, will use that as adults. So I let my dogs outside as adult dogs as a general rule. But when they're eating and drinking 4 times their normal amount, they're not going to get through the night. And I'm not good at getting up 4 times during the night to let them outside. So I find the litter tray to be really useful. You can use a lot of different surfaces. This particular tray is what you put underneath a washing machine. So you can buy them at the hardware store so that if you have a washing machine that leaks, it doesn't leak through your floor. So it's about $20 for one of those trays. Not expensive, not hard to find. You can use rabbit trays. You can use little aluminum pans. I use a paint pan for my very, very young small puppies because my little corgis don't have long legs. So I'll take a metal paint pan and fold the legs out flat so that the tray is very shallow on one end, deeper on the other, and you can buy liners for those so that you don't even have to clean the tray out. So there's some very cool things you can do with some imagination. All right, deworming, I do want to talk about this because this is near and dear to my heart. You probably don't have as much of a parasite problem in the northern areas that you live in as we do in the United States, but roundworms and hookworms are a big deal, and if the dog ever had roundworms or hookworms when she was young, those will insist in her muscles and reactivate and migrate through the bloodstream and into the placenta and through the bloodstream and into the mammary glands when she is pregnant and nursing. So using fenbendazole, which is in the US not a prescription item, I don't know about Canada. We use it from the 5th week of pregnancy through the 2nd week of lactation. So for 5 weeks, 35 days straight, not the 3 days it says on the label, 35 days. It is off label, but by doing that, you will keep the roundworms and hookworms from migrating through the placenta into the puppies and through the mammary glands and into the puppies. And I have clients that come in all the time and tell me, throw their arms around me, well, they did before COVID, and say, Dr. Greer, I have never had such healthy puppies because they're not born with parasites, and at the time you're weaning them and they're starting to develop the parasites in their intestines, you're weaning them, you're changing them onto food, you're changing them onto water. Now they've got parasites in their intestinal tract. Those puppies don't feel good. They have diarrhea, they have belly aches. They feel so much better when they don't have parasites. It really, really works well. So keep that in mind if you have problems with rounds and hooks. If you don't do that protocol, the recommendation by the CAPC, which is the Companion Animal Parasite Council in the US, is to deworm with one of the parental pamoate products like Nemex at 2, 4, 6, and 8 weeks, or to start your heartworm preventive at 8 weeks and make sure that you're getting parasites under control. We have a concern about puppies that are sold into households because this roundworm and hookworm is a zoonotic disease, can transmit to humans and people that may be immunocompromised, young children, elderly people, people on chemo, people on other drugs for autoimmune diseases are immunocompromised and can pick up those parasites. So it's very important that we're selling healthy puppies. Again, parasite control, very important that we're putting our dogs on heartworm prevention and on intestinal parasite control as well as flea and tick medications. Trifexis in the US is not labeled for use in breeding animals. ProHeart and most of the other oral heartworm medications are. And for parasite control for fleas and ticks, we have lots and lots of ticks in Wisconsin. The only oral medication we have in the US that's labeled for use in breeding dogs is Bravecto. Many of the topicals are safe, but many are not. So be sure you're reading the label. And when you read the label, see that it says breeding animal. It doesn't say pregnant dog, it doesn't say female, it says breeding animal. So you can Google search the PDF product insert on any product that you are buying for flea and tick and for heartworm control. If your veterinarian's not familiar with what's safe and what isn't, you can Google it, find it yourself, read the PDF, and make sure that it says safe or tested as safe in breeding animals. All right, now we're getting ready to sell the puppies. You want to make sure when you take them to your veterinarian that you get a comprehensive physical exam. We look for eye problems, ear problems. We look at the mouth, checking for things like tooth alignment. We check for lymph nodes. We check for skin, any kind of coat problem, rash, or parasites. For hearts, super important your veterinarian listens for a murmur. There's a lot of things you can detect, but most clients are not going to be able to get a stethoscope and detect heart murmurs. So don't sell your puppies to people that have not had a veterinary exam, and making sure that you're not selling puppies with a heart murmur. Rib cage, we look at the shape. Hernias, we look for umbilical and inguinal hernias. For joints, we look for patellar luxation, hip clicks. For toes, we look at the number of toes and their toenails. For abdominal palpation, the organ size, rectum, make sure they have one. Generally, if they don't have a rectum, you're going to find that out when they're 2 days old. Prepuce, lots and lots of puppies have that kind of sticky mucousy discharge from the end of the penis. Absolutely common, not anything to worry about. And on the females, they'll have that puppy sticky vaginitis. Again, not anything to worry about. But puppies should have, boy puppies, I'll be clear, male puppies should have both testicles in the scrotum by 3 weeks of age. So that's what we have for puppies. We do have the pandemic puppy book, and we do have the canine reproduction and neonatology book. So if you're looking for some resources, The pandemic puppy book goes through about half behavior and about half on medical care. So I've been making the people that want to buy a puppy from me read the book before they buy the puppy so that I know that they've already gone through the thought process of, I'm going to be living with this dog for the next 15 years. I need to select it carefully. It goes through traits of different breeds of dogs. It goes through all kinds of stuff. So very helpful. And if you don't have the Canine Reproduction and Neonatology book, or your vet doesn't have one, buy two. Buy one for you, buy one for your vet, because the veterinarians find it to be very helpful as well. So very important that you have resources because, as you know, you're on your own a lot of the time now with COVID. I don't know about your veterinary appointments, but in the U.S. we've been very difficult. It's been very difficult for clients to get appointments when they need to, even on an emergency basis. So we want to make sure that you're well educated and have access. So thank you for joining us for the series. It's been lots of fun doing this. I've really enjoyed being here. So I'm going to turn this over to Alice. And
hello, everyone.
Go for it.
Good evening. Great to see so many people from across Canada joining us tonight. My name is Alice Keith and I'm with Greer Pro Club. So don't take your bathroom break just yet if you can wait, because I'm going to tell you a little bit about the benefits we offer to breeders and what our #1 Pro Plan formula is with breeders in just 1 minute. But first, an introduction to Pro Plan nutrition. ProPlan is backed by a team of over 500 scientists, including pet nutritionists, behaviorists, and veterinarians. We were the first dry food brand with real meat as the #1 ingredient in all formulas, and all of our high quality ingredients are chosen for a specific purpose, and our highly digestible dry formulas promote nutrient bioavailability. And did you know that ProPlan is chosen by more dog show champions than any other brand, including many of the top 10 all breed dogs in Canada for 2021? Dr. Greer, can we go to the next slide? All right, so #1 formula, no surprise for those who have been attending our webinars with Dr. Greer. It's the Pro Plan for Performance 30/20 All Life Stages formula. This formula supports the nutrition and energy needs of pregnant and nursing females and their puppies. So 30/20 stands for 30% protein and 20% fat. And this concentrated nutrition helps optimize oxygen metabolism for increased endurance. And that's why it's also very popular with sporting and competition dogs. That said, we have a full assortment for various nutritional needs, from sensitive skin and stomach, which is also very popular, to formulas for breed sizes, weight management, various proteins, and more. Next, please. So Pro Club, our program for breeders, offers great benefits, including savings on every purchase of Pro Plan, free delivery for large orders, and unlimited free puppy kits for your new pet owners. That includes a small retail sized bag of Pro Plan. And new for this year, we're also adding three free small cans. We really value breeders and provide one-on-one customer service out of our Canadian office to make sure that your needs are met. So if you're interested to learn more or sign up, please visit us at purina.ca/proclub. So we are now going to take a 5-minute break and then get Q&A going, which is always fantastic.
So let's get right into it. We have a question from Kim Mason, and she was asking about your thoughts on ultrasounds. That one came in really early, so I think it's when we are talking about doing x-rays for puppy counts.
Sure. And ultrasound is not going to give you as accurate a count as a puppy count x-ray for a couple of reasons. In early pregnancy, we can miss some when we do an ultrasound, like at 4 weeks. We can also have resorptions, so you may have fewer puppies. We've seen entire litters resorb, so an ultrasound is an estimation, but it's not accurate. At term, the puppies are so crowded, it's very difficult to count the number of puppies. So it's more like watching a movie instead of watching a photo. So you're really best off to take a puppy count x-ray. And I know people get frustrated by inaccuracies, but if you're working with a veterinarian that's helpful and you enjoy working with them, see if you can work with them a little bit to improve their ability to get good quality puppy count x-rays for you. Most veterinarians are happy to help you out. They have technicians that want to do a good job. take them a plate of cookies or, plate of brownies, a nice pie. You can talk technicians into doing pretty much anything legal as long as you feed them.
Aaron is asking, what do you give for additional calcium?
Depends on which stage you're in. During labor, I'll give sub-Q 10% calcium gluconate if I have access to injectable. If I don't, I use the calcium gel. The Oral Cal Plus is my preference. And then once the puppies are born, you can use calcium tablets. There's a number of calcium tablets on the market for veterinary use. Some are pretty tasty and pretty chewable. Others, if you don't have access to anything else, you can buy the human calcium, the 500 or 600 milligram calcium with vitamin D that you would probably take for yourself if you were an older person taking calcium as a supplement to prevent osteoporosis. So they either come as 500 milligram or 600 milligram, usually with some vitamin D. You can buy them in tablets. You can buy them in chewables like a caramel. Tums don't have enough calcium to really be as effective as we'd like. So I buy the stuff that I know how many milligrams, 500 or 600 milligram. Small dogs may get 1 a day. Large dogs might get 4 a day. It's hard to overdose oral calcium. It's easy to dose too much injectable calcium, but it's pretty hard to give too much oral calcium. So if the dog takes in more than they need, they typically just excrete it out through the GI tract.
Sherry is asking, how do I give SQ fluids?
Yeah, and that's something you probably are going to need your veterinarian to help you with. You're going to need a needle, you're going to need a syringe or a venous set, and you're going to need a bag of fluids. I don't know if those are prescription items in Canada. They are in the United States, so you probably have to either talk to your vet or order them with a prescription from one of the catalog companies. We do have a video on the Revival Animal Health website on how to give sub-Q fluids. It's a cat, but cats and dogs are given the same way. But you probably are going to want a vet tech or a veterinarian to teach you how to do it hands-on the first time that you do it. We have a lot of clients that are very skilled at doing it. They may have an older cat and kidney failure. They may have a bunch of dogs. So it is certainly a skill that most clients can learn, but you probably want to talk to your veterinarian or veterinary technician, getting back to take them a 6-pack of beer, take them a box of cookies. You can, many vet techs don't get lunch. So if you take them food, they will jump through hoops for you if you're feeding them what they like.
Now, Amelie had one in French, and from my very basic Northern Ontario French, I believe she's asking, what is the reason why we shouldn't use essential oils?
Some of them can be toxic, and they're not as effective as, like lavender is not going to give you the same effect as a pheromone. Yes, it comes as a collar. It's supposed to be calming. Pheromones are specific to the dog. The pheromone, like I said, comes from the mammary gland and from the placental fluids. So it's actually the pheromone that the female, the mother dog, is making. When I finished a C-section and I have some of the fluid on my scrubs and I walk into the next exam room, those dogs are attracted to that smell. There's something very, very attractive about that smell. So the hormone collars, the pheromone collars of Adaptil or Thunderies, whatever they call them in Canada, are very, very specific to the pheromone, and it's much more helpful than just a lavender collar. And some of the essential oils can be toxic, especially to small puppies.
Larissa asks, what is considered a fever in the bitch after she's given birth?
That's a great question because it depends a little bit on how you're keeping her and when she was outside last. If she just came in and it's 15 below, it's going to be a little bit cooler than if she was laying under the heat lamp with the puppies. Now, I personally don't use heat lamps. I like to heat from underneath. We've talked about that in former seminars. I like to heat from underneath, and usually the female will lay in an area that's more comfortable. But anything up to 102 rectally Fahrenheit, it was probably going to be about 38 or 39 centigrade, is going to be okay. But above that, she's running a fever. If you think she's normal, if she's eating and she's drinking okay and her temperature's a little on the high side, you may just have the room too hot. So be attentive to her comfort and your comfort as well as the puppies. They need to be warm, but not too warm.
Elizabeth asks, what is the danger of the metronidazole?
It's possible for that to pass through the milk and into the puppies, and the blood-brain barrier in puppies does not prevent that drug from becoming excreted and circulating into the nervous system. So we can see neurologic problems associated with metronidazole given to puppies that are too young or the nursing mothers. So I just don't use metronidazole until the puppies are at least 8 weeks old. Their little blood-brain barrier is porous and it allows that drug to get in, and metronidazole is a neurotoxin if it's given at too much a dose.
So we have a few related questions about weaning puppies and feeding them puppy food. So the first one is, what age do you recommend weaning puppies, in particular small breeds?
Sure. And smaller breeds I wean a little later than larger breeds. Um, my corgis, I'll start weaning when they're about 3 to 3.5 weeks old. I'll start them on a little food so that by 4 weeks they're pretty effectively eating. I try not to wean puppies much younger than that unless the bitch is sick. If the bitch is sick and she's got mastitis and they're 12 days old, you might have to start feeding them a little bit younger. Smaller breed puppies are going to wean later and harder. My farm dog puppies at 6 weeks want nothing to do with solid food. All they want to do is nurse. So at some point, you finally have to say, you got to start eating, kids. So it can be a little harder with the small breed puppies because their mothers are nice to them. They put up with it. They're not Labradors. They're not Piranhas. So it is a little harder, but every breed is going to be a little bit different. The smaller, the later, and the smaller, the harder. I'm just going to say that.
And then Catherine said, puppy foods always say 8 weeks and older. Is it safe then and sufficient to be feeding that at the 3 to 5 weeks, as you were saying?
Yes. Yeah, you almost have to be feeding them that, but they typically, the 8 weeks is when they're going to be hitting people's homes for the new pet owners. So oftentimes those are really what they're putting the labels together for, are people that are taking their new puppy home, not the breeders.
For extra fluids on low puppies, can we feed natural or electrolyte foods such as coconut water, watermelon juice, that sort of thing?
I don't know. I stick to dog electrolyte solutions. There's a couple good ones. There's Puppy Light. There are some puppy electrolyte solutions. I don't think those things would cause any harm, but I don't know that anybody's ever really looked at it.
Heidi is asking if you happen to have a copy of the 100 Things in 100 Days you talked about.
Yeah, there's actually some information in the pandemic puppy book about that. It goes through, and the other place that's a really good source is Sophia Yin has a website with that kind of information on it, so you can bop onto there and take a look. But mostly it's your own creativity because every situation is different. I have clients that when they had young puppies during some of these times that are a little harder to get out, they were taking them to the lumber yards. Menards or Home Depot or Lowe's were letting puppies in. So the farm stores, the pet stores were letting people in with them. So a lot of it is you need to come up with your own creativity and your own particular circumstances where you live and what you have access to. But be creative. I go to garage sales and pick up little kids' toys that are safe for puppies. They're brightly colored, they make funny noises, they roll around. People give them away practically. They're $1 a piece at the garage sales or yard sales or rummage sales or whatever you call them where you live. So, use your own resources. I picked up kids walkers because that gives puppies a chance to be used to something that's moving. Wheelchairs. I mean, there's just so many things that you can access in your own home. Just think about what you have that you can expose your puppies to. It's actually a lot of fun.
So on the topics of the litter box training,
Yeah.
for lack of a better word, Nancy said she's got a standard poodle litter. They're almost 5 weeks now. She started with wood pellets. She stopped because one of her puppies was starting to eat them.
Mhm.
She was wondering if she could try again at this point. Any suggestions?
Yeah, you can try again. I would avoid cat litter because if they're going to eat something, they could eat that as well. But they also make a pelleted newspaper. So I think that if they did eat the pelleted newspaper, it would probably break down adequately in the intestinal tract. I have corgis, they're like cardboard, and I've never had a corgi eat the pellets. So I'm not really sure. Maybe you need to give the puppy something else to do. To chew on, some other kind of a chew toy or rawhide or stuffed toy or something to keep them distracted, so they do use the litter box for litter and not for entertainment.
Christine also asked if she could use horse bedding, a wood-based horse bedding.
Yeah, those wood pellets that I use are actually horse bedding. They're made by the Marth company. They're just pelleted pine. I try to avoid the cedar type of products because those are too aromatic. They're very strongly scented, and we see puppies kind of coming in with watery eyes and runny noses from that. But sticking to the pine products are fine.
Um, we have a question about the Panacure dosage. So what is the dosage for Panacure for a bitch from the 5th week of pregnancy to the 2nd week of lactation?
So it's 50 milligrams per kilogram. I'm just going to see if I can flip back to this slide. It's 50 milligrams per kilogram, which is the standard dose on the label. You can use the granules, you can use the liquid. I think the liquid is easier to administer, but for some people they prefer the granules. So it's the 50 milligram per kilogram dose. Oh, I must have missed it somewhere. But it's at the standard 50 milligram per kilogram dose once a day, and you give it from the 3 weeks before they're due to have the puppies to where the puppies are 2 weeks old. So it's 5 weeks. It's a long time. The label says 3 days, but the protocol is 5 weeks. And for people that are like, oh, my vet doesn't know anything about it, this was published in 2002. This is not newly published information, but it's not widely circulated. So there's your product.
And with the Panacure protocol, would you still recommend deworming the puppies?
Oftentimes you don't need to. It's probably a good idea to have a fecal checked because it won't get Giardia at that early an age. It won't get tapeworms. It won't get coccidia, but it will do rounds and hooks, which are the most common intestinal worms that we see. We rarely see whipworms, and those don't migrate through the placenta or through the mammary gland anyway. But I typically don't need to deworm if I've done this protocol. I don't need to do this protocol at 2, 4, 6, and 8 weeks if I've done this protocol for the bitch. And it doesn't taste great. You need to mix it with something, peanut butter or Splenda or something that's tasty enough that they'll take it. But it is so effective. Like if you have problems with parasites, it will blow your mind how much healthier your little puppies are when they're 3 and 4 weeks old. You won't be paying your veterinarian to see them for sick puppies with diarrhea. You'll be staying home and having a much nicer day.
Faye is asking if the bitch is 6 weeks pregnant, can they still start this regime?
Yeah, I'd go ahead and start it as soon as you can get your hands on the Panacure. Fenbendazole. It's not too late.
And then on the topic of deworming, Catherine's asking, I'm going to assume she means Damascus earth. Would that work?
I'm sorry, what product?
DE, I'm pretty sure it's the short form for Damascus earth. I might be pronouncing that incorrectly.
Oh, diatomaceous earth.
There we go.
Yeah. No, there's no studies that show that diatomaceous earth is an effective dewormer. So I would use something that we know is effective.
It's 8 o'clock.
Alrighty, we're going to jump to a slightly different topic. Isabella is saying, if you have said that the male pups should have their balls down by 3 weeks old, can you please clarify that a little bit?
A normal puppy would have testicular descent by the 3rd week. So you should be able to feel both testicles. Now in small breed dogs, it can be hard to feel them, but a normal puppy should have testicular descent by 3 weeks of age. If it's not down by 3 weeks, that's delayed and you need to be concerned that they might have a retained testicle when they get to be older.
Kathleen asks, how long should a bitch have bloody discharge after whelping?
Ooh, that's another interesting question. It's very common to see it for probably 3 to 7 days, depending on if she had a C-section or a vaginal birth. Some bitches with C-sections don't have any discharge for the first couple of days, and then the cervix opens up and then you get a gush. So for 3 to 7 days, not uncommon to see bloody discharge that should gradually change to a lighter color. It's called lochia, where it's kind of a light gray and then it finally goes away. But there's a condition called SIPS, subinvolution of placental sites, so SIPS for short, where at around 6 to 8 weeks of age, especially on first litter bitches, that they will suddenly have this bloody, mucousy, bright red bloody discharge vaginally, and that is the uterus healing from the pregnancy. It's most common in first litter bitches, not anything to be concerned about. The bitches aren't sick, there's no bad odor to it, they feel fine. If there's a bad odor to the discharge, you have metritis, you need to go to the vet. But these SIPS dogs at 6, 7, 8 weeks of age, they'll be walking through the house and all of a sudden, bloop, this blop of bright red mucousy blood comes falling out of their vaginal area. It doesn't smell bad, doesn't seem bad. The dogs aren't sick. It's just the uterus healing. So it's called subinvolution of placental sites, or SIPS. Very common. If it's enough to cause blood loss, there is a protocol for treating it, but most bitches, it resolves on their own. They don't ever have to have treatment for it.
Alrighty. Sorry guys, I was just reviewing to see if I can smash some questions together. So
There's a lot of
Karen,
questions.
a lot of questions tonight. That's good. People are involved. Karen is asking, if we supplement calcium after whelping, do we need to worry about supplementing phosphorus?
No, because that goes hand in hand. So just calcium is all you need.
All right, Patricia, how do you know when it's time to administer oxytocin?
For lactation, for whelping, for maternal skills. There's 3 uses of it. I don't know if she's on and can respond.
Just about to say, Patricia, if you're on, hammer another question into the Q&A there and I'll scoot down to the bottom and see if we can catch it.
Yeah.
We'll jump on to the next one. Jill asks, do you recommend treating newborn puppy navels? Why or why not? And if so, with what?
Absolutely, positively, every navel in my hands gets treated. We treat as soon as the cord is cut at 2 hours, 8 hours, and then twice a day until the cord falls off. And I use tincture of iodine, which is a combination of iodine and alcohol to dry the cord. There was a period of time in veterinary medicine that it was recommended to use chlorhexidine, and I actually had one of my own puppies die from an umbilical infection when chlorhexidine was the only thing used, because it did not dry up the cord fast enough. So it's a combination. It's tincture of iodine. You can buy it in that form. It's a combination of alcohol and iodine. It very briefly will cause some staining. People get all upset about it, but even on a white puppy, the staining is gone within a couple of hours. It doesn't last for a long period of time. And what that does is it dries up the cord, seals it off so that bacteria don't ascend up the umbilicus into the abdominal cavity and cause peritonitis and acute death. And I mean, I had this puppy at 2 o'clock in the morning, he was fine. At 4 o'clock in the morning, he was dead. So it can happen so fast, you don't even have time to get him on an antibiotic. So please treat all your cords. C-section, vaginal birth, doesn't matter. Treat all your cords, birth 2 hours, and then twice a day until the cord falls off.
So we did have Patricia respond about the oxytocin.
Good.
She said for whelping, and then we had a few people say they'd also be interested in how the answer applies for the other uses as well.
Sure. So oxytocin during labor, I am very conservative in the use of it. I don't use it unless I know for sure that I need it. If the bitch is having hard labor and she's effectively contracting, you don't need it. You never give it before the first puppy is born. You never give more than 2 doses per puppy. And if she's in hard labor, you just flat out don't give it. She's already pushing hard. Oxytocin's not going to help her to deliver a puppy. It needs to be used very conservatively. We use teensy, eensy, weensy little doses. What's on the label and what's probably floating around on the internet is generally too high of a dose. So for even the biggest dog, it would never exceed in my hands a half a cc. And for the average size dog, it's going to be somewhere between 1/100th of a cc, and which is just so small an amount you can barely see it in the syringe, and maybe 0.2, 0.3 cc's. It's a very small dose. Don't do it more often than every 20 minutes. Don't do it if she's in hard labor. Don't do it before the first puppy is born. If she's just laying around and needs a little boost to kind of get things going again, a smaller dose of it, sub-Q is fine. For other reasons, for improving maternal skills, because it improves the calcium bonding in the brain with oxytocin, and remember the little video, oxytocin is the potion of devotion. It'll improve maternal skills. So you can use that, and you can use it for lactation. And again, that's going to be like 0.1 to 0.2 cc's. And you can do that every 4 hours along with warm compresses on the bitch's mammary glands to improve the letdown of milk. So Reglan metoclopramide makes milk and oxytocin lets milk down. So they do two different things, but you can use them together because they do two different things. One makes milk, one lets it down. Together they work beautifully in improving lactation.
Okay, we have a few questions about metritis. And if it happens to a bitch, do you see much reoccurrence in future litters or any correlation with pyometra in future heat cycles?
No correlation with pyometra. And I normally, if I see it once in a female, I don't see it another time. I think people are that have had it happen to them once are very attentive to making sure that they see all the placentas developed, all the puppies developed. And it's actually not common. We might see 1 or 2 cases of metritis a year in our practice, and we see hundreds of pregnant dogs a year, hundreds. So it is not common. I've been told that basset hounds are predisposed to it. Don't routinely put dogs on antibiotics just because you're concerned about it, but do be attentive to the number of placentas that are delivered. Be attentive to making sure that maybe she did get a little oxytocin at the end of whelping to clear things out. Talk to your veterinarian. Again, oxytocin is a prescription drug, so you're going to need to talk to your veterinarian about that drug.
So Patricia was advised by their breed mentor to give folic acid daily before whelping. What does this accomplish, and is it necessary?
Folic acid is important in reducing the risk of midline defects. It needs to be started 6 weeks before the pregnancy starts because it's to help fetal development, to keep them from developing a midline defect, meaning cleft palate, umbilical hernia, open abdominal wall, those kind of midline defects, most commonly seen in the brachycephalic breeds. So if you have Frenchies, if you have Bulldogs, if you have Pugs, if you have Chihuahuas, if you have a breed or a line of dogs that's predisposed to developing midline defects like cleft palates, folic acid reduces the risk of that. But like I said, you have to start at 6 weeks before the pregnancy. So you don't wait until she's pregnant. You have to start it much earlier than that if you're going to get an effect out of it.
Dawn has a question about whelping box temperature.
Yeah.
Some of their mentors have told them that keeping the box at 90 to 95 is imperative in the first few weeks.
Mm-hmm.
They let the bitch and puppies tell them what temperature is appropriate. Do you have a guideline?
I usually start at 90 degrees the first week and drop 5 degrees a week after that. But it depends on the breed, it depends on the room temperature. So it does depend. I like to heat from underneath, not from above. I don't like heat lamps. I think they're putting your dogs at risk of dehydration. I've had a fire start in my own barn from a heat lamp, so I'm pretty paranoid about heat lamps. So yes, but there are going to be dogs that are really uncomfortable at that temperature. There's going to be dogs that are cold at that temperature. So if you have a case hound or a Samoyed, they're probably going to want a slightly lower temperature. If you have a Chihuahua, you're probably going to want a slightly higher temperature. So yes, dictating it. If the puppies are piled on top of each other and you take their temperature rectally and it's below 96 degrees, they're too cold. Heat them up. If they're all spread out and you take their temperature and it's 99 degrees, they're too hot. Turn it down. So your rectal temperature of the puppy is going to be your best indicator. So buy a thermometer, check them rectally, and if they're too hot, turn it down. If they're too cold, turn it up. But watch them. If they're piled on top of each other, they're probably cold. If they're spread out doing one of these things, they're probably hot. So really pay attention. And it drops 5 degrees a week. As the puppies have the ability to increase their body temperature 1 degree a week, you drop the temperature in the room 5 degrees a week because it's inverse relationship. They get warmer and warmer as they get more mature.
Darlene asks, how long between puppy births is okay? When should we be thinking about taking them in for a C-section?
Yeah, and there's no really good answer to that. there was a study done 4 or 5 years ago at the Theriogenology group, which is the veterinarians that do reproduction, that said more than an hour between puppies increases the risk of fetal death. But you can see bitches that'll rest an hour or two very comfortably, and then they go back into labor and everything's fine. It's more a matter of if it's a couple of hours, if you're checking fetal heart rates and they're dropping on a Doppler, um, if you're having puppies that are born dead, if she's pushing hard and not making progress, that then you don't wait. I mean, if she's pushing and pushing and pushing and nothing's happening, and you've put your fingers in a glove, you reach in and you can't get a hold of any puppy, you need to go in. If she's just hanging around relaxing and things seem pretty normal and she's having a little ice cream and having a little rest, and you take her outside to go potty, take your flashlight. It's dark at 4:30. Take your flashlight so you know what she's not dropping a puppy out in the snow. So you have to use some judgment with it, but more than 2 or 3 hours, I would be seeing a veterinarian if you have access to one.
Tanya says, once whelping's in progress, their vet does not want to administer oxytocin. Is there a reason they would be hesitant? You did mention that you had given one to a flagging female a dose to encourage delivery of the 5th puppy.
Yeah, and that I knew I had 5 puppies on the X-ray. I knew she had, and I had just been to the lecture on the theriogenology lecture in Milwaukee the night before, and they said more than an hour, and you get an increased risk of fetal death. So I'm staring at her, going, "Okay, it's been an hour. You better hurry up." So it's really a judgment call on when you decide that you're going to need it and how much to need. It takes some experience. So if you're new at it, get a mentor that's experienced or get a veterinarian that can help you.
Sorry, I was just pulling up a screenshot because I saw a really good question that I wanted to save earlier.
Good.
And it was from one person. They said they're a new breeder. They have their first litter coming in about 17 days. What are the most important products or items they should have on their list for whelping?
I can refer you to our website, our clinic website. I can send a list if you want to send me your email address. It's a pretty long list of things that you want to have around. So it's about 30 different items that you're going to want to have. Most importantly, you have a cell phone that has a charge on it and gas in your car. After that, I wouldn't whelp without calcium gel, and I wouldn't whelp without a Dealy mucus trap and a heat source. So thermometer, whelping pads, calcium, oxytocin, baby formula, baby bottles. It's a long, long list. I'm happy to share it. If you send me your email address, I will respond.
Marilyn is asking, do you have suggestions for treating Giardia or Giardia? Sorry for the mispronunciations, guys.
Yeah,
And
Giardia.
recommendations to prevent reoccurrence when sending puppies to their new homes.
Giardia's a bugger because once you get it in your facility, it's very, very difficult to eliminate it. So fenbendazole, the same thing that's on the screen right now for deworming the bitches, does a pretty decent job of getting rid of Giardia. Sometimes we have to use fenbendazole along with metronidazole. It may take more than one drug. In the US, secnidazole is not labeled for use in dogs, so I don't use that. I'm not sure about Canada. But most of the time, if you have good hygiene, so you keep the stools cleaned up, you use fenbendazole, and you get rid of the other parasites like roundworms and hookworms, you're probably going to be okay because Giardia doesn't typically cause serious disease, but a lot of people really freak out when they take their dog to the vet. They've got a new puppy, they go to their new vet, they do a stool sample, they find Giardia, and they'll sometimes just lose it. They'll be like, "Oh my God, this is horrible. This breeder is terrible." If you've got Giardia at your kennel, you're probably never going to get rid of it. We don't have a vaccine. We don't have an effective drug that consistently kills it all the way along the way. And frankly, when we have positive Giardias on adult dogs that don't have symptoms, we don't even treat them because there's no point. And we now think that Giardia in dogs is different than Giardia in humans, that it probably doesn't pass back and forth between people and dogs. So that has made people a little bit more relaxed about not being as concerned that they're going to end up with a zoonotic infection. But really, fenbendazole for 5 days. Fenbendazole is labeled for 3 days for roundworms and hookworms. For 5 days, it'll get Giardia in most cases. And then you may just need to repeat it periodically. What I typically would do if I have Giardia in my facility is the last 5 days the puppy was at my house. If you've got puppies leaving on Saturday, start them on fenbendazole the Monday before they leave. If they're all leaving on Saturday, great, treat them all at the same time. If they're staggered in the times that they're leaving, count backwards from the day they're going to be picked up and just do 5 days before they leave your house so that they're leaving as clean as you can make them. And just tell people, sometimes Giardia will show up on the ELISA test, not the flotation where they see the cysts, but the ELISA test where they look for the protein. That can stay positive for an extended period of time. And in fact, the company that makes the test won't even tell us how many days, months, weeks it can stay positive. They don't even have published information on that.
On a similar vein, Catherine is asking about parvo and if it would be safe to boost the dam closer to whelping time or a couple weeks after during lactation.
It's not recommended to vaccinate during pregnancy. So no, I wouldn't vaccinate during pregnancy. There is a blood test you can do called a nomogram where you can test the bitch's own antibody levels and based on that decide when you need to vaccinate puppies. So there is that information. If you want that, I can email it to you. As far as vaccinating, we start puppies at 6 weeks. And it's not just parvo that you have to be concerned about. You have to be concerned about the overall health of the dog, their nutritional plane. If they have other parasites, that's going to set their GI tract up for being more likely to get parvo. They need to be in good health, robust, healthy puppies with no parasites. So there's a lot of factors that come into play. And as I said in the one slide, Albon for the last 3 days at your house and the first 3 days in their new home can help stabilize the bacteria in the gut and reduce the risk that those puppies are going to get parvo. The other thing to be aware of if you have parvo on your facility is that is often caused by raccoons that use latrines. Raccoons build latrines just like outhouses, and they will go to that area. And if one of your dogs on your property runs over to the raccoon latrine, which is frequently on a fence line or a tree line around your property if you live out in the country, they can bring it back to the kennel and cause a lot of dogs to get sick. So the Center for Disease Control in the United States, so cdc.gov, if you type in cdc.gov raccoon latrine, it will take you to a web page that will explain to you how to locate the raccoon latrines and how to disinfect them and destroy them so that you can get rid of parvo in your immediate kennel area. So if you're having parvo, those are the things I do: a nomogram, a raccoon latrine protocol, deworming, and then vaccinating is only one piece of that.
I'm going to guess it's pronounced Nisha. Nisha says, vet tech here. Any link or research for the 35 days of fenbendazole during the gestational period? They would like to be able to ask to prescribe it without being laughed at.
Yeah, you shouldn't get laughed at. Dr. Kazkos did this publication in 2002. And again, if you email me and ask for the link to the resource, I can send it to you. It's not new. Many of the veterinarians in the US that do a lot of canine reproduction have been doing this for a long time. So, but if you're going to go back to your vet clinic and say, this is what I want to do, they're going to want to see the information behind it. So I'm happy to send you the link to that article.
And on a similar vein, Crystal says one of the biggest issues they have found moving back to Canada is persuading vets to use meds off-label, even things like using plasma when no colostrum. It wasn't so bad before with the border closed, but is there anywhere we can order things like Reglan, domperidone from the States and ship it?
I don't know exactly what those regulations are at this point. So I'm not sure I can specifically help you. If you email me, I'll see what I can do in your particular area for specific things. I don't know if Canada has a blood bank for dogs, if you can order your plasma from there. Many of the drugs, yeah, it's funny, in the US we have Canada drugs. I, seems a little counterintuitive, doesn't it? But if you're looking for a specific product, I can see if I can help you out. Some of them are prescriptions, some are not.
For sure. And sometimes even we ask these questions live, obviously, out loud. And Crystal, look in the chat box because a lot of times people who have found these products in Canada will put little tidbits of information there as well. So, all right, what are we at? We're at 9:21. So we have a little bit of time to answer a few more ones. Here's a fun one. Candace, I've heard that feeding the bitch celery and parsley when weaning will decrease lactation. True or wives' tale?
I have no idea. I think that'd be fun to try. I do know cabbage leaves on a gland with mastitis can help. Just peel the cabbage leaf off, put it on the mammary gland. I don't know if celery and parsley will help. I have no idea.
Stephanie asks, what is a good milk replacer for newborns if mom is out of commission?
I don't know what you can get. I love Royal Canin's milk replacer. I like Esbalac. I like Foster Care. Those are the ones I typically use. I don't like the homemade ones because they're going to be deficient in arginine and lysine, and those are going to lead to possible nutritional cataracts. So I tend to use the goat's milk Esbalac. I tend to use the Foster Care by Revival. I don't know what you can get in Canada, but homemade ones are fraught with all kinds of nutritional imbalances. So try to buy one that's commercially available.
I've seen a few similar questions on this. Any tips or tricks to help prevent water puppies, or swimmers?
Yeah. Swimmers and anasarca puppies, water puppies are very different than each other. Anasarc puppies, there really isn't anything that you can do to prevent it. There are people that have tried reducing hydrops and anasarc puppies with giving a diuretic to the bitch. It is not safe. I would not recommend it. Swimmer puppies tend to be puppies that are kind of flat and tend to splay legs. So the bath mat thing that we talked about earlier can help. If you see those puppies, sometimes they need to be rolled onto their side. I will send people out to the store and buy an egg crate mattress, which are those foam mattresses with the lumps and bumps, and it looks like an egg crate or an egg carton. Those put underneath the whelping pads can be super helpful. Sometimes you have to hobble them if they're swimmer puppies, which means put some tape between their legs and kind of keep their back legs closer together so they don't splay out. Some things you just can't prevent. Sometimes they're genetic, sometimes they're inherited, and sometimes it just happens no matter how careful you are.
And we have a question from Nancy, which is actually a little bit of a comment and a great one at that. And she said, would you consider doing a seminar on struggling puppies, issues with fading puppies, low weight gain, etc.?
I would love to do a neonatal seminar, yes. I do those frequently. Neonates are one of my favorite topics, so I would love to do that.
Miranda, besides the bath mats, what's the best way you found to keep the whelping box dry and clean? I've tried the reusable whelping mats, the throwaway mats, and even went to the grass mats to help potty train. Is the vet fleece any good, worth the big bucks, or another suggestion?
I use the whelping mats. I like those a lot. That's what I use in my own whelping box. The reusable ones that you just throw on the wash. I typically, when I have a litter of puppies, my washing machine is going every day. I'm sure yours is too. But I like the reusable, washable ones. They tend to be pretty absorbent. And you can put a bath mat over it too if you're trying to just use something that's more absorption. It has more absorption, but those bath mats allow the urine to drain through. Those are pretty handy, actually. Walmart is your friend.
And we'll do one more. Susan is asking, can you give us some tips on encouraging a bitch to take her puppies and nurse them?
Okay, so the placental fluid, the collar, the oxytocin, the calcium, those are pretty much the tools that we have. And sometimes you just have to sit with her and I have sat on the floor for 3 days straight, other than running to the bathroom with bitches to just get them settled in and accustomed to it. It can be really a struggle. And they're really, you need either a movie to watch, a lot of movies to watch, a lot of books to read, a cell phone that you can hang on to so you have something to do. I I don't really have any other tricks other than those. Like I said, calcium and oxytocin help with maternal skills. The collars help. But sometimes it just takes sitting there and being patient with her until till the mom gene like kicks in and she finally looks at him and goes, "Oh my gosh, those are my puppies? Well, why didn't you tell me that 3 days ago?" And typically at 72 hours, magic happens, but it's a long 72 hours if it's one of those girls. Been there, done that. I have sat with bitches for 3 days straight.
Alrighty, I'm just typing a message into the chat. There are a lot of people asking if we're going to get to their questions. We've got through about 60 of them. The chat's still showing 99 plus to go. So unfortunately, we're not going to be able to get through everybody's. Thank you, though, everybody who has put questions in here. We save all of our questions even after the webinars are over. And what it does is it allows us to go back through all of them, look at some of the most popular questions and topics, and then talk to Dr. Greer about doing more webinars on those. So maybe even we just have a webinar itself on some of our most common questions and answers that we get. One of those questions, I'll throw it back to you, Dr. Greer, was for us Canadians, where can we buy the books that you had mentioned?
I believe Amazon has them for you. If they don't, let me know and I'll help you figure out how to get them. But Amazon should carry them, and they should both be available and in stock. And if you want to do just a Q&A webinar some night, that's always fun too, we can just talk. So I am more than happy to answer as many questions as possible by email. I want to make sure everybody feels that their voice has been heard and that they are able to get the information that they need, because it's a big commitment to breed dogs, and I want you to be supported.
Wonderful. And we have lots of space open in our schedule for 2022 to have Dr. Greer back. So we will have more webinars for everybody.
Great.
So there were also a lot of people who jumped on the list of supplies. So I say we, so myself and Alex from Purina will work with Dr. Greer. We'll get that list, we'll post it, and we'll share it with everybody so that we don't have to, or she doesn't have to individually email each one of you. So we'll share that out and we'll post it somewhere so that it's available for you to read whenever you'd like at 3 a.m. while you're sitting there waiting for puppies, maybe. And
maybe a few days before, so you can place your
true.
order.
Yeah, 3 days before at 3 a.m. when you're sitting there going, "Oh my gosh, I'm gonna have puppies soon. What the heck have I got myself into?"
Exactly.
Perfect time to jump onto Amazon or call your local TSC. And also the recording. So this webinar, like all of our other ones, were recorded. If you're a CKC member, all of these are posted on the portal underneath the resources, underneath educational resources. If you're a Purina Pro Club member, you'll get an email from them within probably about a week here with a link to watch the video again. And I do know that they have a resources section as well on their Pro Club. So if you're not a Pro Club member already, join up on that so that you can get access to a lot of great more resources like this webinar. And yeah, other than that, those are my big topics. It's 9:30 Eastern time on the dot for us. So thank you everybody for joining us.
Thanks. This has been a lot of fun. We'll do it again.
For sure. Bye everybody. Stay safe, stay healthy. Have a good night.
Warm. Good night.